Welcome. In this video, we're delving into a rare and complex eye condition called epithelial downgrowth glaucoma. This is a serious issue that can threaten vision, and understanding it is crucial for early detection and effective management. We'll explore its causes, how it affects the eye, the symptoms to look out for, and the treatment options available. Join us as we unravel the intricacies of epithelial downgrowth glaucoma. Epithelial downgrowth glaucoma occurs when epithelial cells, the cells that normally cover the surface of the cornea and conjunctiva, grow abnormally into the interior of the eye. The most common cause is previous ocular surgery, particularly cataract surgery, penetrating keratoplasty, or glaucoma surgery. These procedures can sometimes create a pathway for epithelial cells to migrate inward. Trauma to the eye, especially penetrating injuries, can also introduce these cells into the anterior chamber. Rarely, epithelial downgrowth can occur spontaneously, but this is exceptionally uncommon. Now, let's discuss the intricate mechanisms of this disease. Once inside the eye, epithelial cells can proliferate and spread across various structures, including the iris, trabecular meshwork, and even the ciliary body. When these cells cover the trabecular meshwork, the eye's natural drainage system, they obstruct the outflow of aqueous humor, the fluid that maintains intraocular pressure. This obstruction leads to elevated intraocular pressure, causing glaucoma. Additionally, the epithelial cells can incite inflammation within the eye, further contributing to glaucoma. The chronic inflammation and high pressure can cause irreversible damage to the optic nerve, leading to vision loss. Epithelial downgrowth glaucoma is a relatively rare condition. Precise epidemiological data is limited due to its rarity and potential for misdiagnosis. However, it's estimated to occur in a small percentage of individuals following intraocular surgery or penetrating ocular trauma. The exact incidence varies depending on the type of surgery performed and the presence of other risk factors. It's important to note that while rare, the potential for significant vision loss makes it a clinically important entity. The signs and symptoms of epithelial downgrowth glaucoma can be subtle initially, often mimicking other eye conditions. Patients may experience blurry vision, eye pain, redness, and light sensitivity. A hallmark sign is the presence of a fine, translucent membrane on the iris or cornea, which can be difficult to see without specialized equipment. Elevated intraocular pressure is a key indicator, and the presence of keratic precipitates and inflammatory deposits on the cornea may also be observed. In some cases, patients might notice a gradual decline in their visual field. Diagnosing epithelial downgrowth glaucoma can be challenging, requiring a comprehensive eye examination. Slit lamp biomicroscopy is essential for visualizing the epithelial membrane and assessing the anterior chamber. Gonioscopy, a procedure using a special lens to view the drainage angle, can reveal the presence of epithelial cells obstructing the trabecular meshwork. Confocal microscopy can help visualize the cellular structure of the membrane. In some cases, anterior segment optical coherence tomography, OCT, can provide detailed images of the anterior segment. Finally, if the diagnosis is uncertain, a biopsy of the affected tissue can confirm the presence of epithelial cells. Fluorescein angiography may also be used to highlight vascular changes caused by the downgrowth. While not strictly classified into types, epithelial downgrowth can be categorized based on the location of the epithelial cell proliferation. It can be localized, affecting a small area of the eye, or diffuse, spreading extensively throughout the anterior chamber. The location of the downgrowth, whether primarily on the iris, cornea, or trabecular meshwork, also influences the clinical presentation and treatment approach. The treatment of epithelial downgrowth glaucoma is often complex and requires a multifaceted approach. The primary goal is to eliminate the epithelial cells and control intraocular pressure. Medical management includes topical glaucoma medications to lower intraocular pressure and anti-inflammatory eye drops to reduce inflammation. Surgical interventions are often necessary and may include cryotherapy or photocoagulation to destroy the epithelial cells. In more severe cases, surgical excision of the affected tissues may be required. Techniques like intracameral 5-fluorouracil 5-FU or other antimetabolites can also be used to inhibit epithelial cell growth. Multiple surgeries may be necessary to achieve long-term control of the disease. Newer approaches such as mitomycin C have also been tried. Unfortunately, there's no guaranteed way to completely prevent epithelial downgrowth glaucoma. However, meticulous surgical technique during intraocular procedures can minimize the risk of epithelial cell introduction. Prompt and thorough management of penetrating eye injuries is also crucial. Careful follow-up after any eye surgery or trauma is essential to detect early signs of epithelial downgrowth and initiate treatment promptly. The prognosis for epithelial downgrowth glaucoma can be guarded, as the disease can be difficult to eradicate completely. Early diagnosis and aggressive treatment are critical for preserving vision. Even with treatment, recurrence is possible, requiring ongoing monitoring. Recent research focuses on improving diagnostic techniques and developing more effective treatments to target epithelial cells while minimizing damage to surrounding tissues. Advances in surgical techniques, such as minimally invasive glaucoma surgery and IGS, may offer promising options for managing intraocular pressure in these patients. Ongoing research into targeted therapies and immunomodulatory agents holds promise for future treatment strategies. Thanks for watching, and we hope this video has provided a comprehensive overview of epithelial downgrowth glaucoma.